The project we're working on today, these days, is about preparing or helping hospitals prepare for disasters. We're using technology to train them in how to organize the incident command during a disaster event. Well, first of all, the hospitals use the hospital incident command system as the methodology in the nation here to organize themselves in front of disasters. So in case you're not familiar with the HICS, it's based on the incident command system, which is a component of a larger system called the National Incident Management System, which is promoted by FEMA and other federal agencies in the nation. And it's basically a method in which, it's a hierarchical methodology. The hospital, the staff organize themselves in some positions with roles. Every role has specific tasks and responsibilities and tools and so on. And everybody in the hospital could play a role in that hierarchy, in that HICS system. Okay, so the hierarchy, that HICS system, does not necessarily follow the hierarchy of the organization. Okay, it's an ad hoc system for the management of the disaster in particular. So we hope that the hospital train multiple people to play every role, so they have better chances of having someone to play the role when the disaster strikes. How will they get involved in this? Well, in Bethesda there are three hospitals, right? It's Suburban Hospital, which is a community hospital, the only trauma hospital in the county, actually. We have the NIH Clinical Center in the NIH campus, and also on the other side of Wisconsin Avenue, we have the Walter Reed National Military Medical Center. And they created this partnership, the Bethesda Hospital's Emergency Preparedness Partnership, with the intention of sharing resources in case that something big happens in the capital region. Okay, so NLM got involved in this a few years ago with the intention of providing support for research and development projects. Even though the hospitals conduct some research, not this type of research. So NLM is helping them. We have 11 projects going on. Hospitals must train on HICS. It's a requirement for accreditation. Okay, so they use a number of methods for that, from classwork, personal classwork, or all the way to full-scale exercises that may involve multiple organizations. The hospitals have to take a number of issues when they train. Okay, people not always come well prepared for exercises, for example. So these are just a few of those issues. It's very costly to organize, to prepare, conduct an exercise. The staff gets distracted in the training. Okay, they don't have time sometimes, so to really remain all the time in those sessions. They have difficulty scheduling training sessions because they have a very crazy schedule, and sometimes even when they are in the hospital, they don't have the time to really participate, or full time the training session lasts. They have difficulty simulating all the conditions they need to simulate for the disaster event, for the scenario. It's complex to capture data to do the post-exercise assessment, and so on. So we're testing technology to help them. Virtual reality technology in particular. We don't know whether this technology can really help these hospitals in particular. Virtual reality has been around for a long time now. It's nothing new. It's being used in many places for training. But the hospitals have particular conditions there that make it difficult to introduce new technologies to them, for example. Okay? So we are developing a virtual reality platform. They come together into a virtual world, basically, where they exercise. So we can do many things in there. And for the purposes of building this, we depend on contractors. Aquilent helped us start this project some time ago, and they subcontracted with the Center for Health and Homeland Security of the University of Maryland. And they helped design the exercises, conduct the exercises in the virtual world that we built, and then do the analysis of how well the trainees did. This is how it looks, basically. It's like a computer game. They come through the internet into a virtual room, okay, the Emergency Operations Center, simulated one. It has a number of information tools, real-time interactive tools in there that they can use as they practice their scenario. There are communications tools as well, so they can communicate from that a simulated emergency operations center outside to the other places in the hospital. And there are 3D maps that not only show the status of the hospital anytime, but also the results of the decisions during the exercise. There's a video online also. They provide the URL so you can watch it later, I guess. Findings, we have to wrap up. It has been a wonderful experience. The hospitals have adopted this. I think they want to do more in terms of training with this capability. It's been amazing to see how the people training remain through the whole session in the training. They have been able to practice things they haven't been able to practice before. For example, for the first time ever, they practiced a total hospital evacuation in January. So it's been fantastic. All right, that's it.